Hi, my name is Jessie Fontalvo, and I'm going to be presenting on the foodborne disease Salmonella. So the problem exists in society because it spreads through contaminated food or water. It also spreads through animal feces and their environment. So it is retrieved from eating uncooked or raw meat, poultry, or egg products. The disease can also be retrieved from just about anywhere contamination can exist. So wildlife, animals, feces, restaurants, grocery stores or markets, international travel, to maybe other countries that don't know how to properly restrain the disease yet. The bacteria lives in the intestines of humans and animals and is released in feces. So on this picture in the top right, I specifically note where in the intestines it grows and reproduces. So the risk for the community in the future. More groups are susceptible than others, so we have children under 5, adults ages 65 or older, people with weakened immune system, and pregnant women who are more susceptible. And they can have extreme consequences, such as bacteremia, which is basically the disease where the bacteria has infected your blood, and at that point, it can get anywhere in your body. So it can cause meningitis, which is basically when the bacteria reaches the tissue around your brain, or it can also reach your bones, and another consequence is it can cause reactive arthritis, which is basically when you get, or it can basically cause like extreme eye irritation or extreme pain when urinating. The bacteria is also known to develop resistance against antibiotics, so it's extremely important to take antibiotics as prescribed, not more or less. Etiological factors include poor hygiene and proper handling of meat, so that means not cooking it properly or thoroughly, such as microwaving meats is definitely something you don't want to be doing, or cross-contaminating with raw meat and cooked meat. So how to solve the problem? So basically the two strategies that I listed here are already being implemented in society. So we have monitoring cooking etiquette, so properly storing and cooking raw meats and poultry, cleaning surfaces thoroughly to prevent cross-contamination. So on the right I've added this photo, which you don't want to be doing, which is putting raw meat with vegetables or cooking or cutting vegetables on the same board that you also dealt with raw meat. And so for the second strategy, I included enforcing hygiene, so applying rules for proper hygiene in restaurants, public restrooms, food vendors, chefs, cooks, public areas just in general. And so for a historical example, I've added in terms of the United States that we now have the food handler certificate. So basically, in order to work in any company or facility that works with food, such as grocery stores or restaurants, you need to have the certificate which proves that you were trained on how to properly handle food and sanitize facilities. So I've included on the top right what it looks like in the Riverside County because I'm from Riverside. And so another example is a cultural example in Europe. So in Europe, Salmonella is the second most common zoonotic disease. So a zoonotic disease is basically a disease that can be passed on from an animal to a human. So there they've done, all states implemented Salmonella control programs in poultry and set targets for the reduction of it in poultry flocks. Restrictions were also imposed on the trade or products from infected flocks. So I've included this figure to the right here, which shows how the number of cases of Salmonella in Europe have drastically decreased over the years. So obviously the programs are working. So how literature says the disease should be dealt with. So in the African Consensus Meeting of 2014, it was deliberated that in order to fully deal with the disease, more research needed to be done to understand its complex host-pathogen relationship. In general, most countries emphasize good hygiene, which includes washing your hands, cooking food thoroughly, along with avoiding cross-contamination, properly refrigerating eggs and milks, being careful with reptile, pets, or wildlife animals or amphibians because those groups tend to have more of that disease in them. And then I've included pictures here of washing your hands and then avoiding this cross-contamination seen in the photo. So in my opinion, the prevention of Salmonella definitely has a lot to do with personal hygiene and proper food handling. And I think the best way to tackle this disease is by educating young people, so in elementary school, on how to properly perform hygiene such as washing your hands or showering. It's also important to constantly monitor restaurants, grocery stores, farms, meat factories to ensure cross contamination, sanitation, cooking, and food storage is done properly. And this is especially important in raw meat factories or farms. So here are my references, and thank you for listening to my presentation.